a Chicago Bears quarterback, Jim McMahon,
Yeah.
who was prescribed painkillers, opiates for years,
Yeah.
came off of it and smokes marijuana every day and feels like that's been a big saver for him, getting off those drugs and using marijuana.
Well, in that specific case, I don't know the details, but I remember Jim McMahon. I mean, I think he got that's a whole
big
other
time.
issue.
Yeah.
He got banged up.
A lot.
Chronic. So anything that could help him provide relief, and medicinal marijuana, if that's the answer, that's fine. I just worry about the kids, the adolescents. We know that the brains haven't developed. The marijuana has a direct impact on the brain of these kids.
Definitely.
And
I mean, what do you tell parents? Do you say, okay, don't let these kids touch marijuana until what? What is there a good age where someone could actually? I mean, when the body is ready for it.
Well, that's one of the reasons I don't want to write their certificates. We don't really know, as physicians, we don't really know the effects, the side effects, the long-term effects. It really has not been studied, partly because it's not a available drug. It's a Schedule I drug. It's in the same schedule in Massachusetts as is heroin, meaning there's no reason to prescribe it. So that, or to even issue those certificates. So that's something that has to be corrected. I mean, federally, it's illegal. It's an illegal drug, still. But the government is sort of looking aside at the states, Colorado, Alaska, Oregon, and Washington, that now have recreational marijuana in addition to medicinal marijuana. I think it's going to be an issue. It's a problem. The main concern I have is the potency of the drug.
Mm-hmm.
It's the scientists that are developing marijuana continue each year to try to increase the THC and outdo their competitors. I don't think that's healthy.
And getting back to the kids, just stay away from it. Don't even try it.
Well, that's what I would say. And they mentioned about it, parents. I think it's just another example where parents have to have ongoing conversations with their children, starting at a very early age. The kids are going to do what they want to do, but if the parents provide their own opinion and support and availability, then it might lessen the chance of the kid.
I think it affects you as an adult. I think you're better off not smoking it until you're 25 years old. I mean, this is my own opinion on it. Until your body and your mind are mature enough. And I don't mean psychologically. I mean physically. Your brain is still evolving when you're a teenager.
That's a good point. You're absolutely right. The brain, as best we know, is still evolving until like the mid-20s.
Yeah.
So fooling around with these drugs that can cause dependence, addiction,
and psychosis in some cases, right? Which you see sometimes where it just goes, and these people are lost forever sometimes.
My my colleague across the hall at first year medical school, who now is an extraordinarily successful doctor, I was with him when he tried marijuana for the first time in the dorm. And he had a panic attack, a full-blown panic attack, which I had never seen before. And we, as his classmates, we all quieted him down. I'm sure he's never used it since. And I saw that, and I said, it wasn't for me.
Yeah. So what about you? I mean, why is it that you're a psychiatrist, first of all? What is it that interested you in the beginning to coming to this job?
Yeah, well, my subspecialty is addiction, so I'm called an addiction psychiatrist, which is a certification for that. I think I'm a product of the 50s and 60s, and I was fascinated by the people using LSD and ecstasy and all that stuff way back then, and alcohol. I did my training at a hospital in Cambridge where alcoholism was rampant in the population, drug use, family dysfunction, and it just intrigued me. And in addition, I think the majority of the people I continue to see with these problems, they're very interesting people. They've been through so much. Most of them have survived all kinds of things. And then when you see people who get into recovery, sobriety, who've really turned it around, it's just a blessing. It really is satisfying for me. And
and that's a good point you bring up. As far as folks dealing with siblings or love people they love. How do we deal with people that are addicted to whether it's drugs or alcohol? What do you have advice for that on?
Be supportive, be caring, get involved as much as you can. Make sure the person knows that you have some understanding of what they might be going through. Talk with them, be there, and avoid stigmatizing, avoid having an attitude, avoid sort of telling the person what they need to do, belittling, demeaning.
Right.
These the opioid, the heroin addiction, in my opinion, even though it affects the same areas of the brain as alcohol, is much different. This people who become addicted to the opioids, they're going to struggle most of their life either staying off it or trying to stay off it. Unlike alcohol, where 12 steps, AA, that works. People can have 20, 25 years of sobriety. It's very, very difficult for an opiate heroin addict to be off everything, be abstinent, and stay clean. That's why we have these programs, methadone programs. We have Suboxone. We have these medically proven programs that assist the person in staying clean. Now, people say, well, that means you're substituting one drug for another. No, we're not. We're providing an opiate medication prescribed to help people stay clean, get their families back together, work, avoid disease, avoid hepatitis. And I've seen that, especially in the methadone programs, where I see patients that have been on methadone for 20, 25, 30 years. People say, oh my God, they're going to be on it the rest of their life. Probably. But they're happy and they're doing well. So society, and I think the family and relatives, have to sort of learn to understand that and accept it, which is tough to accept, but diabetics need insulin the rest of their life. You wouldn't take somebody off insulin after 4 years or 2 years. People with hypertension need medication. So there are many chronic diseases where people are going to be on medication for many years, and opiate addiction, heroin addiction is one of them.
Right. So support is key.
Support is key. It's so it's not easy, but I think that if family members and relatives don't understand it and get turned off by the consequences of the addiction, the stealing, all the behaviors which are not good. But nobody with a heroin addiction is proud of that. They don't like that. They're sick and tired. They want to stop, but they can't stop. Relapses are very, very common. And it's a struggle. It's a lifelong struggle.
So with the people that you've helped and that are healthy, is there one common thing that they all do, aside from taking the drug, the methadone or whatever you give them? Is it something inside them that?
It's first of all, people with addictions are all very different, so there's not one category. But to answer that question, I would say the people that are doing well have really committed themselves 100% to staying off the drug. And they're going to do whatever they need to do to stay clean. They're going to change.
They visualize themselves off of the drug.
Yep.
They see themselves as somebody who doesn't take drugs.
Right. And they recall and remember in their minds what it was like when they were using, and they don't want to go back there. And so they either have supports, they have people, they have peers, they have programs, they have counselors, physicians, everybody working together to help that person. And they do well. It's not hopeless. I've tended.
Yeah, and when you say well, I mean they're functioning. They have keep jobs. Some of them are successful, I imagine.
Starbucks manager of a store on Suboxone doing extremely well. Hotel, a woman that manages a hotel on methadone doing extremely well, and not on methadone was not doing well. So they can go down. There's so many people that are doing well. I used to run a physician health program. Not many doctors use the opiates, but those that do, they're on methadone, they're on Suboxone, and they're doing extremely well. Some are returned to practice. Some licensing boards have allowed it. That's a new one for the medical licensing boards to try to accept that. But we're educating them too.
Right.
Doctors are no different.
Yeah.
So, in that subject,
Gee.
what I get concerned about, having dealt with many, many physicians. How about the physicians that are on Percocet and oxycodone for back pain, whatever, and we don't know about it, and the patients don't know about it.
Sure.
So,
the police.
Yeah.
And how they, because you say it's so bad of a problem, they must see it all the time.
Yep.
Don't they need to be a little more sensitive to how to deal with it now instead of just locking people up? And I mean, not that they would do that, but I'm assuming that they're being trained to deal with crises like these.
Absolutely. I don't know how widespread that is, but I think it is. The whole country is starting, from President Obama on down, we're starting to recognize this is a disease, this is an illness that has to be medically treated and not seen as a crime. We've filled up the jails with people who have been addicted or low-level dealers, and we're starting to release them because they never should have probably been there to begin with. I think the police are becoming much more sensitive in some way, and maybe in a small way, because the police probably have family members that have these same issues.
Right.
Because it's so widespread. But the police, I think, are recognizing that if somebody is overdosed on the street, you have to help. This business of Narcan and being there.
Oh yeah.
It's. I worked at the detox program in Roxbury, middle of Roxbury, recently, and for a year, and I was the medical director of the detox program. The Boston police were extremely sensitive. They were really good, and very, very helpful.
Well, look, you got to catch your flight.
Yep.
I want to thank you. What are you doing with the rest of your day?
I'm flying back.
You go back. You're back in Boston.
I go back to Boston.
Do you go right back to practice? Do you have people you have to meet?
Yeah, actually, today, it's a little bit light today, but then I'm part-time in a methadone program. I work I do some things at the Mass Medical Society, and I have a private practice. So, but I'm also kind of taking life a little easier.
You deserve it. Thank you so much.
Okay,
this is really interesting.
Thank you.
Okay.
Yeah.
Let me help you out here with your stuff.